Hello, good afternoon, everybody. I am so excited about today's Monday Motivation Talk. We have a special guest, and she's going to be joining me in just a moment. It looks like Instagram is still telling folks that we are going live. We are so on time today. I'm so impressed with us. Immunology, microbiome, gut health, and your fertility. These are super important things that we are going to be covering today. And then, okay, now we're good. So everybody, I want you to meet an incredible researcher, Gabby Gutierrez. Did I say your complete name correctly?
Yeah, it's perfect.
Okay, excellent. She is the CEO and founder of Microgenesis. She has incredibly important research to share with us today and an incredible opportunity. So sit tight for the whole episode if you can. This is the kind of conversation that could be a game changer for your fertility journey. So a couple of quick things about Gabby so I can brag on you. You have 15 years of research in reproductive immunology. And I think one of the most compelling things about you is you treat the tough cases. You've treated 3,000 of like the hardest cases.
Exactly. We want to start with those cases, with those complex fertility cases, because they are the ones that are hopeless. So science moved and start from that point, right? Offering help for the ones that already are hopeless.
That's just amazing because I think that for patients, when we're struggling with fertility, we go through this roller coaster of feeling hopeful and then feeling hopeless. And you have I think, testing those really tough cases, researching those really tough cases, you are creating a pathway for the hopeless to have hope again.
Right. Yeah. This means for us that we only have the chance to demonstrate fertility specialists that our science is helpful for these people, even they don't need an in vitro fertilization of after they fail at least 4 in vitro fertilizations. So that woman give us the opportunity to demonstrate that for fertility specialists, not only for them. So that's why we are so happy with our data. And yeah, we already studied 287 in vitro fertilization failed women, and 75% of them are already pregnant.
It's amazing. So before we even do a super deep dive into that, I want to back up for a second and hear your pathway to this research. What inspired you to focus your microbiome research on fertility?
I'm a reproductive immunologist, and I spent my entire life as a scientist trying to help fertility patients to control inflammatory processes that are affecting the fertility potential to improve the fertility treatments. So as an immunologist, I realized that all these subclinical inflammatory processes are affecting fertility, but in the future, they will become a disease itself. So we are preventing an inflammatory condition and at the same time get the people pregnant. So during these 15 years working with these inflammatory factors, we realized that all of them, or the majority of them, were connected with an intestinal condition. And microbiota explained that if we are able to recognize the microorganisms that help people to keep metabolism and inflammation in balance, we were able not only to get the people pregnant, but also to avoid different diseases such as diabetes or celiac disease, for example.
All right, so let me make sure that I totally understand that myself, so it's clear to our community members that when your gut health is out of whack or out of balance, then it leads to an inflammatory response in my body, which then can lead to other diseases.
Yes, let me explain this. We have an intestinal barrier. This intestinal barrier is like a frontier. They decide which is good to enter or which is not. But what happens if this frontier gets corrupted? This will create a different conditions that will affect your health in general. For example, if the intestinal barrier gets or increase their permeability, that means that different factors, for example, food components, will enter into your bloodstream, and it will create an alert for your immunological response, because it's not normal that the gluten, for example, will enter into the bloodstream, right? Because it should keep out of the intestinal barrier, in the lumen of the gut, not inside. So our immune cells will recognize the gluten as an strange thing, and they will create antibodies against the gluten. But the problem is that the antibodies against the gluten recognize a molecular part of the gluten that is pretty similar to our intestinal barrier. So we will creating damage to the intestinal barrier at the same time, and they will start a process in which the damage to the intestinal barrier will create more increased intestinal permeability that will create more food components get into our bloodstream, more inflammation, more autoimmunity, and the autoimmunity will affect different glands. For example, the ovaries itself or the thyroid.
Okay.
And all this inflammatory process in progression will affect your fertility. So we need to control the permeability of the intestinal barrier in order to keep your metabolism in balance and to keep your fertility potential during your fertility years, right? So who is controlling the intestinal barrier structure or permeability? Microorganisms that are part of our microbiota. And that microorganisms are very difficult to recognize from the ones that are not good ones, the pathogens. So that's why we needed so long time to understand that we need microorganisms. But we need to differentiate which ones are the good ones and which ones are the bad ones. So when we use an antibiotic, we are not differentiating this process. We are killing all of them. And we are, during our life, using drugs such as antibiotics or using different chemicals in the food. We are losing microorganisms that we will need in the future.
So when we do that, and we could go, down to the Whole Foods or to the market and buy an over-the-counter probiotic, right? Why is that insufficient? If I have bloating or gas or, maybe some symptoms of what you're talking about with an inflammatory response to food. I definitely have issues with dairy. If I eat too much gluten, I'm miserable. Although I'm not I'm not allergic to gluten. So why is it insufficient for me to just go down the street and buy, a multi-strain probiotic as an experiment?
That's a great question. It took a lot of time for women to understand that they should eat better in order to improve their fertility potential, right? Sure. So all of us started to avoid the gluten or to buy probiotics over the counter, etc. The problem is that only a little percentage of these women have good pregnancy results using this non-personalized product. And this is because our microbiome is like our fingerprint. Every one of us have a unique microbiome. Of course, there are a few species that we scientists recognize that have a very important function in different health situations. For example, autoimmunity, for example, to avoid metabolic syndrome, or the ones that are implicated in estradiol metabolism, which is very important for fertility. Sure. But in general, which ones are gonna lose during our life, or which ones will overgrow in response to those missing microorganisms will depend on everyone. Right. So we will need the exactly probiotic in order to replace the ones that we are missing. And we need to avoid the probiotic that already contains the one that are overgrowth in ourselves. So we need.
Yes, that makes perfect sense. I love the analogy that your microbiome, so your individual gut, okay, for everybody who's tuning in, your individual gut and everything that's inside of it is as unique as your fingerprint. That's amazing. Right. And the thing that's overwhelming to me in my mind is it seems that there's always something changing our microbiome. Right. Exactly. So if there's an onslaught of chemicals or one round of antibiotics or, hormone treatment or whatever it might be. So it seems that it keeps getting worse and worse and worse and worse.
Exactly. That's it. That's why we want to offer an alternative to replace the traditional hormones or if they will need an IVF treatment and they should use hormones because they have another factor, for example, sure, anatomical factor or sperm factor. We want them to have the microbiome fixed to take this treatment and do better. If you're not able to metabolize correctly, every single oral treatment will have not succeed, right?
Right.
That's why we develop a test that will recognize which species should we replace with probiotics, right?
I see.
And which one you should avoid because they are already overgrowth. This is very important because most of the probiotics over the counter contains lactobacillus. Mm-hmm. And in the 68% of our patients, lactobacillus were already overgrowth. Wow. So we need to avoid these products, right?
Right. Because then that could create, so when I first spoke to you, you used the term dysbiosis, right? So if the gut microbiome is imbalanced and you have too much even of a good thing, that can be bad.
Mm-hmm. Exactly. That could be worse.
It could be worse. Exactly. So it's not just that your microbiome, and hey, Rocky, I was talking to one of our patients today who's become quite close to me over the last few weeks, Rocky, about this process is that if you have too much of a few good bacteria, it's not necessarily that you have too much bad, but either scenario can create inflammation, which then can cause infertility and can set you up for poor outcomes, even if you're doing IVF, right?
Exactly.
I have it right so far? Okay.
So that's why we created this test in order to study just this little part of the fingerprint that is connected with fertility.
Okay, great. So this is so fascinating. And I love it because the people that you studied were really complex cases. Right?
Exactly.
So talk a little bit about them.
Sure. In average, they spent 10 years in IVF procedures. At least 4 IVF procedures was failed after they will be included in our test and treatment. So 4 in vitro fertilization failed and 10 years seeking for pregnancy. So only 26% of them got pregnant before, non-babies born. So that means 26% of miscarriages in our cohort of patients. But after our test and treatment, within 6 months, we already have 129 live birth babies.
Amazing.
So we are very happy because we met every single baby already from Spain and Argentina.
Oh, that's amazing. That's amazing.
Yes.
That's incredible. And I want to make sure that everybody really understands this. So they studied the hardest patients. They studied women, average age was 40, if I'm not mistaken, right?
Yes, exactly. 40 years old.
Yeah, 40 years old, which is considered, geriatric. We hate that word, but it's considered old. I'm in that demographic because I'm now 44, but they studied older women who already had multiple failed IVF cycles. And in some cases, they even were failing ovum donor cycles. And
Yes.
you didn't do any surgical procedures to the uterus. You didn't do anything outside of testing their microbiome and then replacing and then customizing a probiotic blend for the microbiome, correct?
Correct. Exactly.
Okay.
Yes.
So first, before we get into the solution, let's actually dive into the test. Okay. Because it's not available yet, but what is available is MedAnswers is supporting this research, this market research initiative by helping to pick 40 members of our community to participate in a study. And I'm one of them. So I'm going to show you guys what it is. I've never been an influencer before, Gabby, but this makes me feel like I'm one of those influencers on Instagram. Like I hold up the test kit, I'm doing the unboxing. It might be mirror image, but it's Microgenesis. It's a very simple kit. And when I open the box, there are 3 parts to the test. So can you describe for us, now I know that there's a very simple blood spot test. I'm going to do the blood prick right on camera. There's a saliva, a little spit tube that I'm going to spit in. My mother would kill me if she knew I was spitting in public. She always hated that. So blood spot, that, and then there's a vaginal swab. And then what do you do with those 3 samples that tells you what my microbiome looks like?
That's a very important question. The vaginal swab brings us the possibility to study the messengers that the microorganism will create when you have a overgrowth of lactobacillus. That means they will expose a lot of molecular parts of the lactobacillus that are unique for lactobacillus to the immune cells at the intestinal barrier. And those immune cells will create specific messengers, very tiny molecules, but very important ones called microRNAs. Those microRNAs are able to travel from the intestinal barrier into every single part of the human body. They can change your behavior.
Wow.
They can change the functionality of your ovaries. They can control genetic expression, and they are linked to different conditions such as endometriosis, autoimmunity, metabolic syndrome, hypothyroidism, chronic anemia, chronic hypovitaminosis, all the things we found in our cohort of patients. And we already have 15 years of experience connecting this situation, these subclinical conditions, with the fertility potential.
Got it. This is a very simple, so this is what the vaginal swab kit looks like, everybody. Super simple. It has instructions. I'm not doing vaginal swab on camera. Just everybody just know that. I'm not doing a vaginal swab on camera. I only go so far. I know Katie Couric did, a colonoscopy on camera on the Today Show, but this is not the Today Show, and I'm not doing that part today, but I will do it off camera. So on this, it has really simple instructions with pictures to make it kind of simple and easy for everybody. But the cool thing is that this study is so that you can do the test and the solution in the United States at scale, right? It's so that you can start selling this solution. So we have, cool opportunity for 40 people to get it for free. So we have in the saliva kit then. So that explained the vaginal swab kit and what that can tell. What does the saliva tell you?
The saliva will tell us how it's about your immunological response into these microbiome changes. It will be enough to defend you from different diseases, or will be insufficient, so you will get different infections.
Okay, got it. So that is the saliva one, and I have my little test tube here. My hands are clean, and I noticed on the instructions it was very simple. It said I do not need to be fasting, so you can eat. I ate lunch. But don't eat, drink, smoke, chew gum for at least 30 minutes prior to the sample. But it also said, do not brush your teeth, use toothpaste or mouthwash. I did brush my teeth after lunch, but it's been over an hour or so. Is that okay?
Is that okay? Yes.
Okay. And then and then how much of this do I need to go up to? It says
It's
2 milliliters. So just to right there?
the number 2. You're right.
Okay, so it's just to right there. Okay, here we go, everybody. Don't be grossed out. This is for science. All right, let's see how much I got. I have to do it again. I remember doing this for another research study I participated in, but let's also talk about that, Gabby. And before I even get onto the blood spot one, why are you so excited about, this innovation? And I mean, you spent years innovating, right? And to see the fruits of your labor kind of come to fruition has to be so incredibly encouraging and exciting, because you didn't become a scientist to just be researching your whole life. You became a scientist to solve problems, right?
Right. Because we have, when I started as a scientist, I started working with mice, and then we moved into the fertility clinic in Buenos Aires. And as soon I spent time with patients, I realized most of the patients are treated the same way. I mean, even innovation in fertility during the last 30 years is, now everyone should use heparin or not. Is heparin good enough for fertility or is not? But it's not a treatment, it's a diagnosis that brings us the possibility to realize which woman will need a heparin treatment or not. Not if the heparin is good enough for everyone, because we are all different.
Right.
Different person, different situation, different factors affecting our fertility. So we don't need to spend time and money studying the efficacy of one treatment for everyone.
Sure.
We need to spend time and funding to realize or to have tools to recognize the groups of treatment that will be benefit from that probiotic or that one, or not probiotic at all, because this is not the problem.
Right.
So I spent my entire career trying to demonstrate that if we personalize the treatment, we will get better results.
That's amazing.
Better than fertility clinics can do, because 75% is a very high rate, right?
Well, yes, I think that it is a very high rate. I mean, we know that, if people stay the course with IVF, eventually they will succeed. What I love is that, the people who still need to do IVF, or the people who do have genetic issues with their eggs, who do need to do PGT, is that whether this can help people succeed at IVF or succeed without IVF. I think either way, we know that there's so many conditions impacting us. What I love is that you help make healthy moms, which then make healthy babies, and you sort of educate someone about their own family and their own, bodies in a way that can help them for the rest of their life, right?
Exactly.
This is very exciting.
Prevent diseases in the mother, but we can also prevent diseases in the infants, because early onset diseases such as autism is related to microbiome changes. And this microbiome starts intrauterus. Right. The microbiome of ourselves started intrauterus, not when we're born, but before that.
Oh, before we're even born.
And this is because of the microRNAs. The microRNAs can move from the mother to the infant, to the baby.
Wow. Okay.
So that's why in the future we want to study the microbiome exchange between babies, mothers.
That's amazing.
Between parents too.
Okay,
how it's microRNA from the mother affecting the father. This is very important too.
That's amazing. Okay, did you guys get that? How the microRNA from your vagina is impacting the father, and the exchange back and forth of microRNAs while you have sex. That's a whole nother conversation, because that's a big deal. We only think about, STIs and, things like that, but there's a constant exchange going on that can impact everything, which is fascinating. It's actually harder to get to 2. It's harder to get to 2 than one would think.
You need to split 2 or 3 times, bro.
I'm like spitting 4 times now. Okay, so just know that it's easy, but it's hard for me to, I think I have one more spit in me where I have to get to the level 2 line. Okay, so Luciana, this is a really important question Luciana just asked, because she's asking, is there a certain probiotic that is best when trying to conceive? And Luciana, the exciting thing about this research and this test, and Luciana, you might be a perfect person, I have you in mind too, of the 40 free diagnostics that we're doing for this market validation study in the US. The research has already been conducted in Spain and in Argentina, but now we're helping do market research to bring the product to the US. So Luciana, you would do what I'm doing and you would get this free test, and then this company, Microgenesis, would customize a probiotic specific to your gut microbiome. So for anybody who's just coming on, this is the innovation that's so exciting, is that there's very broad spectrum, let's call them kind of like an antibiotic, broad spectrum probiotics. Now, my son and I have been on a 14 strain, maybe it's 11 strain one for years. And I do feel improvement, but I still struggle with chronic fatigue. I am heading into another, he has struggled with bouts of eczema. We both struggle with very dry skin. My thyroid numbers are not perfect. They're a little bit close, call. I also, for the first time in my life, have slightly high bad cholesterol. So there are different things that I'm dealing with at this age where I really feel that learning what my microbiome is doing is going to benefit me, not just for my second embryo transfer to set me up for better success, but really for lifelong wellness, because there are some wellness things that I need to tackle, that are not fully optimized. And I exercise every single day. I eat fairly healthy, I would say, more so than I feel like the average American. And I think that this is, really an exciting opportunity. And that's, Luciana, what the opportunity is that they will customize. But it's not just probiotics that you customize, right? So can you share a little bit about, as I continue to spit, I need to stop talking so I can work up my saliva a little bit better. So share with everybody, in addition to the custom probiotics that you do, what other things are part of this solution, and how long do we need to stay on your solution before we do the next IVF?
Okay, that's good. We use the test from the vaginal swab, we use the result from the saliva, and we use the result from the blood test, because we need to know about your cholesterol levels, and we need to know about your insulin or autoantibodies or vitamins, because we are studying 8 different immunometabolic pathways that are connected to fertility.
Wow. Okay, that's why. So the blood tells you about 8 immunological things.
Right.
Got it.
The blood test and the saliva test bring us the information about how is the progression of the problem right now.
Got it.
So how far is the problem?
Does that look okay?
It's great.
Okay. All right. Yes, I get that. Makes perfect sense. So this is a very comprehensive view that you're doing, because it's not just the vaginal swab. It's not just immunological. It is a very comprehensive view of the microbiome.
Exactly. We study the molecules that are produced at the intestinal barrier in the vaginal swab, because we want to know if they already reach the reproductive tract. Right?
That makes sense, right?
So
that makes sense.
They are there. That means that they are affecting their reproductive tract. So we want to know if they are overexpressed or not, and according to the microRNA signature, we will realize the microbiome changes. But after that, we want to know how far goes the process right now, and if they are affecting metabolism or autoimmunity or your immunological response. That's why we are testing the saliva secretory IgA in the sample. So with all of this information, we categorize the patient into 64 different fertility biome dysbiosis.
64 different ones. That's why it took you 10 years for this research, right? Exactly. Because you had to repeat over and over what those 64 different ones are. That's incredible.
But remember, this is only a tiny part of the fingerprint.
Tiny part of the fingerprint. And now I'm putting this is a little slip of paper. I should have hid my weight on there. So there's just a little bit of information that goes with your sample, just so everybody knows how this works. Just, a little bit of personal identifiable information about you that goes with my sample. So now I'm done with my saliva one. And as you continue to explain what else is part of the solution and what else goes into the report, I will start to open my blood spot one.
Yeah, absolutely. After we categorize you into one of these 64 different phenotypes, we will offer you a treatment. The treatment will have 3 components.
Okay.
Not only the customized probiotic we will send to you, but also we will offer you dietary recommendation. We know that most of women that are seeking for pregnancy control the diet. They already choose to eat healthier, but it's not only about to eat without gluten or lactose-free milk, but it's also to recognize which food components will alter our microbiome, because every microbiome will be different, right?
Right.
So we need to customize the diet to our microbiome situation.
What types of diet customizations are there? Are they hard to stick to?
It only takes 90 days.
Okay.
It could be hard at the beginning during the first 30 days, but after that you will feel the difference, and you will feel more. Your gut inflammation will decrease, and you will feel less tired in the morning, and you will feel like.
So you might tell me
better mood.
I can't have coffee and bread, maybe, right? Like that could be a dietary change that you tell me?
It will depend on the phenotype, but if you have high insulin level, for example, connected to a specific dysbiosis, you will need to avoid bread.
Okay, got it. Okay. All right, that makes sense. And so we have custom probiotics, which I can't wait to learn about when I do my test, and I'll report it, on our Instagram, of course. And you're going to tell me dietary changes, which is so exciting, because I feel like as fertility patients, we constantly want to know, what should I eat? How should I eat? And you're telling us of 3 different dietary pathways, exactly how to eat. But then there's a third component that's customized to your solution.
It's about nutraceuticals, food supplements. For example, vitamins, selenium, glutamine. They are already well-known food supplements that are in the market, and you can find it over the counter. But we will customize the specific combination according to the immunometabolic problem that you have because of the dysbiosis.
Got it.
So it will depend on the phenotype. So we will customize the product for you, or the blending of the products for you. Okay. We will send you the specific combination, doses, and frequency that you will need in order to restore the inflammatory condition.
Great. So it's healing. So you're talking about really healing the gut, and
exactly,
which is, really incredible. And it's only 90 days. I mean, that to me is, we always talk about how men can see quick results because they have a sperm washout every 3.5 months. And I always get very jealous about how efficient their bodies operate, that they can make little changes that can have a big impact, and they only have to wait 3 to 3.5 months to see the impact of those changes, because they can retest, right? So when you complete this for 90 days, your solution for 90 days, and then I go to do my embryo transfer, and then let's assume that I get pregnant, or let's assume that the medications or the pregnancy itself is going to shift my microbiome again. Do I retest during pregnancy, or do I just enjoy, a happy pregnancy?
You will have 75% of chance to get pregnant in this process. So you will not need to retest your microbiome after that, unless you want to have a second baby, right? Right. But if you can try to seek pregnancy spontaneously if you don't need IVF because of another factor. And we already test this in Buenos Aires and in Spain, and with people that was before IVF, and the numbers are even better than the ones that for women that already spent 10 years seeking for pregnancy, right?
Wow,
because
right.
they are younger and they avoid a lot of hormonal stimulation processes. And
right.
in Argentina, we tested 15 women before IVF, and 14 out of them are already pregnant. So
wow.
That means this is our mission, right? To avoid this painful journey, fertility journey for women that they only have intestinal condition. So why they should suffer every single IVF procedure in order to get pregnant if we can replace IVF with nutraceuticals, probiotics, and dietary recommendation. But we can have women that, even though they will need IVF because of another reason, but we can improve the fertility potential that they will need for get pregnant with IVF, right?
So exactly. I mean, like in my case, I mean, I couldn't have a baby without IVF because I had chemo, which I'm sure destroyed my gut. You know, I think that 13 years after having chemo, I still have chronic fatigue because of the chemo. I'm convinced of it, you know, and that's why I'm so excited to even just go through this process with you, because it's sort of, you know, and actually one of our doctors who's in the audience had messages to me that, you know, all of us probably have the opportunity to improve our gut health, right? Because we haven't had access to the diagnostics for this level of personalized precision medicine before. And that's what's so groundbreaking is when you think about it, every single painful condition, chronic condition, fertility has such a specific outcome, right? So we know that 90 days of you know, the diagnostic and the treatment that, or the solution that you're recommending, which is not a, you know, pharmacological solution, but a nutraceutical solution, a wellness solution. So we know that that has such an incredibly exciting kind of outcome because you can tangibly see it, right? Pretty quickly if people, you know, are embarking on IVF and they have this successful outcome. But what people who have migraines, people who have been suffering with gut issues their whole life, people with like you said, diabetes or PCOS, these are conditions that last your whole life, you know, if we don't reverse them, right? For me, chronic fatigue, you know, I used to be able to wake up at 4:30 in the morning and not have coffee and be super energetic all day. And then I went through chemo and it was like a light switch and I was dragging every single day. Sometimes I'm like, it's a 5 cup of coffee day today. And so it's incredibly exciting to know that you can impact the entire world.
Yeah, we need to change our mindset as women. We need to think that infertility is the first clinical alarm of a subclinical condition. So we need to get information about what is the real problem, not just go to an IVF treatment.
I love that. Well, you know, I think that we have an opportunity, you know, to get forward-thinking IVF clinicians to work in conjunction with you, right? Because it's going to make their practice more successful and they'll be able to, you know, hopefully what we'll be able to do is get folks on board so that they recommend their patients work with you alongside, you know, the IVF treatment, which has me excited. So new soul photography, yes, we have a trial that's available in the US. So we are able to accept 40 patients who can get this diagnostic for free and the solution for free right now. This is not a clinical trial. So it's not an IRB trial because the folks at Microgenesis have already done the clinical trials on this process and they know it works. What this is a market study before having wide distribution released in the United States. So we're taking 40 patients and all costs are paid for. This is what the blood spot test looks like. So this is kind of like doing, if you are a diabetic or you have to do insulin resistance, ATS 1985. Yeah, this would be, I think you should sign up for this ATS if there's no, we'll talk about inclusion and exclusion criteria. ATS 1985 has been on a lot of I know a lot of our regulars and I have like a short list, Gabby. I'm like, okay, I want Luciana to do it. I want Rocky to do it. I want ATS 1985 to do it. I want I want Caitlin to do it. I mean, I know I have like a handful of people that I feel like I know so well from them, them being on our shows. So this is super simple. I've done this for another research study before. I'm gonna prick my finger with a small lancet. It's pretty simple. And it's, 5 seconds of ow, and that's it. And then I'm gonna make a dot of my blood on just how many do I need to fill up? 4?
We only need 6 drops.
6 drops.
6 circles. Yes.
Okay, so I have 2 lancets just in case I need to do this more than once. So let's see. It's in case you got to squeeze to get enough of the blood drops out. So I've done this before. This is why I know, but I think that it's really important because when people get stuff like this for the first time, you can always take it to your primary care doctor if you want to. We have an OBGYN through our company who's going to be overseeing this. And okay. So am I doing this I haven't read your instructions, but am I doing this just on my thumb?
Yes. You need to clean this.
So I'm cleaning my thumb with my alcohol swab.
Yeah.
Okay. We're going to let that dry in the air. You can keep talking, Gabby. It's okay.
One prick should be enough in order to print 6 drops. If not, you can use the other lancet. Yeah.
So what did I already screw this one up? Do I just push down, right? I just go like this and push
exactly.
down on the corner?
Yeah,
okay, good. So I didn't screw it up. Okay, good, everybody. All right, here we go. Wait, count me. And then right on the corner, right, is the best spot? Like right on the corner of your thumb is like the best spot, right on the corner?
No, it's here, 45 degrees. Yes.
Okay. Okay, are you guys ready? Count me down. 3, 2, 1. Oh my gosh, that was so easy. Okay. That was seriously so easy. So now I have a little drop of blood. I'm going to do 1. I think I'm going to need to prick again though. Okay, I'm squeezing. 3. Okay, here we go. Another one. That was actually super, 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 super simple, you guys. So if you're squeamish, it's really simple. But is that enough blood or does it need to be bigger?
It's enough blood. A little bigger would be good. Would be better? The last one.
Okay, so I can double it. Okay, I doubled the last one. All right, I'm pushing. I kind of got to push hard, but you do not. Yeah. All right, here we go.
Or you can use the second lancet with your other thumb.
Oh, I'm getting it now. I got the push down. Okay. All right, you guys, it's super simple. Okay, so are those big enough?
That's
all
great.
Right, look at that. Okay. And then it has a little Band-Aid here. So they even include a Band-Aid. Seriously, you guys, I'm not squeamish with like needles and things like that, but I know a lot of people are. And that you barely feel it. That felt like nothing. I'm not kidding. I'm not telling that to everybody just to coerce them into doing this. I'm telling the truth that if you're squeamish about doing this kind of thing, it's quite simple. Now I'm just covering up. There we go. So thumb on.
That's great. That's it.
This is so great. And then you just tuck. Easy.
Yes.
All right. And that is going in a special specimen bag though, because it is blood. So that goes into this giant bag for this teeny tiny thing. And Gabby, to clarify this part too, do I put that little form of my information into this bag into this bag? Okay, into this bag. Okay.
You can put all of this into the white bag.
Oh, I can put the saliva in the big bag too. Okay,
no,
got it.
Just the blood.
No, just the blood.
Yes.
Okay. All right. So this is the test requisition form for the blood, everybody. So I want to be clear on that just in case. Okay. So I'm going to fill this out. It's going to go in this bag. And they sent me a mailing label too. They already sent me a UPS shipping label. So that's super simple. Exactly. All right. Like I said, yes. I'm not going to do the vaginal swab on camera, but I am going to show the components. So simple. So I want to be really specific on this, Gabby, because I feel like this is something that people are going to get and go like, how far up do I go? Because this is a really long vaginal swab.
It's like to use a tampon.
So just that far. Yeah.
Yeah, that's far.
And do you need to rub?
Rotate this, follow the instruction. You rotate the swab, and then you put the cotton part of the swab into this tube in order to squeeze the sample into the liquid. This liquid will preserve the sample.
So do the swabs break off?
Yeah, and then you discharge the swab.
Okay. Do you need one, or do I need to use both, or is there only a backup in case I mess up the first time?
It's because if probably the first time that a woman uses a vaginal swab, we provide two just in order to get enough samples. So
got it. Okay.
If you're agree to repeat the swab, it's better for us to have enough.
I see. So go ahead and put both in, use both and put it in there. Okay. But it's very skinny. So if you regularly use tampons, I don't think it's going to feel like anything, but you don't have to. Yeah, it's plenty long to help get the sample. Okay. And how long does it take? So this is a question that people ask all the time too. So there's a lot of questions that come up on our talks like this. One of them has to do with the MTHFR genetic mutation and whether or not people need activated folic acid, the methylfolate, or if regular folic acid is fine. So when you customize your nutraceuticals, that's probably going to come up in our community because it does come up a lot. When you customize those nutraceuticals, do you use the activated form of folate just proactively for everyone, or is that something that's not really pertinent to the outcome?
No, the nutraceutical we are using are in a safe doses for everyone.
Okay.
It's the same doses you can take for a vitamin over the counter. It's a safe dosage that was already tested for more than 30,000 infertile women.
Got it. Okay.
No side effect. It's a safe doses for all of them. We have 10 different products. All of them are in the market.
Oh, got it. Okay, great. Okay, that's super helpful too. And then I'm going to send in this kit probably not till tomorrow morning. And so I'll refrigerate my saliva sample till the morning. But other than that, there's no special mail-in instructions that I need. I just can send everything in. And then how long does it take to get the test results back?
1 week.
Great. Okay. So in 1 week, then you're going to, and then first you get the test results back, and then who will communicate with me so that I understand the results? Will that be you or?
We will send our complete report telling about the real problem we found in your test. And we will bring you customized recommendation for 90 days. And we will send you dietary recommendation, different menus.
Okay.
And personalized nutraceuticals and probiotic we will ship to your home.
That's amazing. Okay, that's so exciting. So gosh, in just 1 week, I'm going to know everything there is to know about my microbiome. I'm so excited. I mean, having personalized data like this is so empowering. And then I just feel so confident that knowing I'm going to do an embryo transfer next year, that I'm going to solve some health challenges alongside it to reduce my risk of gestational diabetes, hypertension. These are things that just by my age alone, I know that I'm at high risk for, but then, given my current microbiome, I might be more high risk than I even know, right? Because until we figure out what my microbiome looks like, we just don't know. Hi, Dr. Sherry. I'm so glad that you joined. Rocky, I'm so glad you think it's amazing. Because I hope, Rocky, that you qualify for this. Fingers crossed, we can get Rocky in. Let's talk quickly about the inclusion and exclusion criteria. Even though this isn't a clinical trial study, it is a market validation study. So we do need to make sure that you're working with folks. So first of all, is there any exclusionary criteria we should be aware of now that we got everybody excited about it? Yeah,
we will offer women that ask for this pre-release marketing free of cost test and treatment, the possibility to have a meeting with us so we can explain all the inclusion and exclusion criteria. We can have a clinical background from them so we can, after this meeting, communicate every single woman if they have the chance or not to be included in this alpha testing now. Great. If not, we can have a waiting list for our next marketing release.
That's a good idea. Sure.
We want to know about every single woman that will need about this, or they're considering that will be good for our test. And this is because we are offering the test free of cost, because we want to know them. And that's why we are offering to meet every one of them, no matter how many of them we will be. We want to know everyone. And in this process, we will communicate if they are in the inclusion criteria to get into the 40 cohort of patients right now, or we can sign for a next one round of
Got it. Okay, perfect. So eventually what we're saying is everybody's going to have access. These 40, it's not very strict criteria. So drop your email, say microbiome testing, drop your email into my DMs so that I can make an email introduction to the team to get you guys started. You'll also get an opportunity to have a short conversation with the fabulous Dr. Sherry. If you're not following her at Dr. Sherry, you should be. She is one of my most favorite OBGYNs on the planet. And she loves cutting edge research like this. So we're really excited that she can be a part of it too. We do have a comment. I'm so interested by this, T. Wieditz. I hope that you're still watching. Her fertility doctor wants to check the microbiome of her uterus because she's had 3 miscarriages with normal chromosomes. And like, this feels like it would be a perfect fit. I know you wanted people who didn't have more than 2 miscarriages for this particular round of study. Maybe you could have a conversation with her though about doing it. My question is, well, what else is out there to check the microbiome specifically of your uterus? Because this is the only, true microbiome testing, especially with, microRNA that I've ever heard of, Gabby. So what else, might that fertility doctor be talking about? Or maybe that fertility doctor already knows you.
There is a company that already is offering a test. It's an endometrial biopsy to study the percentage of lactobacillus in your uterus. The problem with this technology, of course, is a technology oriented to IVF failure women because it's an endometrial biopsy. It's not for everyone. It's not a non-invasive test. It's an invasive test. But the other problem is if you have not enough percentage of lactobacillus, they will recommend you to use a probiotic. The problem with Lactobacillus Probiotic is that there is a lot of different strains and strains combinations.
Right.
And the ones that are needed to keep the balance of vaginal microbiome are totally different than the ones that are needed to keep the balance of an endometrial microbiome.
Okay.
But if you use a vaginal probiotic in order to restore the dysbiosis of the endometrium, you will create a vaginal dysbiosis at the same time. So that's why we are not agree with this technology.
Got it. Okay.
We will not know about the real problem. We will know if you have enough lactobacillus or not. But if not, you need to use a probiotic, but you will not change your lifestyle or prevent the problem in the future to be repeated, right?
That makes total sense. I hope that was clear, T. We did. I love everybody's handles on Instagram. People get so creative. So what I'm hearing there is it tells you almost like the end result for the uterus, but it only tells you one piece of information about one strain of a probiotic, and that really you don't know what caused the problem in the first place. And the Microgenesis test is really about getting to the source of the problem and then healing the problem rather than in a very highly customized way. I've been in this field for 13 years. I am partnered with Illumina that does genetic testing all over the world, right? I am surrounded by a lot of amazing scientists, and I'm so blown away by the fact that you have discovered and created. I mean, to be able to detect 64 different phenotypes is incredibly groundbreaking. And to be able to then create a solution that's actionable, that's approachable, that I can do just for 90 days to then feel better and have a better outcome. I'm so incredibly excited. I think, my enthusiasm hopefully is kind of coming through the Instagram, because I think that this can be a game changer for so many of us, like for lifelong, for so many of us. So I'm really grateful to you, Gabby.
Thank you, Alice. Thank you for this opportunity. I am very excited to know every single woman behind Fertility Answers. So yeah, hopefully we can meet all of them and we can help them. This is my main goal right now.
Great. Okay. Well, some of you, I know you, and I have my eye on you. So I'll reach out to some of you individually, but those of you who are interested, and I see some of them have come in already, that you're going to send me a direct message with your email so we can connect you right away. I'm so grateful to you, Gabby. I'm so excited to support you. Thanks everybody for joining this talk. And we'll see you tomorrow with Dr. Raquel. She was under the weather last week. So Dr. Raquel, our naturopathic fertility MD, who's going to love what Gabby in Microgenesis is up to. So we'll see you next time. And thank you for your time and for all your hard work all these years.
No, thank you, Alice. This is an amazing opportunity for all of us. I mean, it's very important to having me today for all Microgenesis team. So thank you.
You're welcome. All right, everybody, take good care.